For the past 21 years, I've had the privilege to serve as a clinical ethics consultant, first at Vanderbilt University Medical Center and now at Cedar Sinai Medical Center. And what that means is I'm an individual that gets called by patients, families, nurses, physicians, anybody involved in the care of a patient, whenever they perceive there to be an ethical issue. And my job is to help identify and clarify what are the values at stake for the people whose situation it is. I don't go in and say this is the right thing to do or that's the wrong thing to do. I try to help them find what makes sense for them so that they can make good decisions and then live in the aftermath of those decisions. And in the process of doing that, I encounter a lot of terrible things. I deal a lot with people who are dying. I deal a lot with people who have suffered tragedy and now their life is forever changed. And when I tell people about this, kind of like I'm imagining you right now, when I start to say this, most people say, oh man, that sounds really intense. I mean, like, ooh, I don't know if I'd want to do that. And the thing that's most interesting to me is that I understand that. It is intense. It's serious business. But at the same time, it is, in fact, completely invigorating. It is an expression when I am with people who are in these types of dire situations, stripped of all of the masks, all of the layers, all of the BS that most of us wear when we walk around in the world. Stripped of all of that, what I encounter and what is expressed is pure humanity. And so I have the privilege, and I use that word intentionally, to be able to be with people in these moments. And I think one of the best ways to capture it is for me to tell you a very brief story. This is from about, maybe 18, 19 years ago. I was working at a hospital in Nashville that Vanderbilt had connections with. And there was a cardiologist there who was the kind of physician that the other cardiologists all went to him when they had problems with their own patients. In fact, they went to him when they were patients. He was that kind of physician. He was well respected, well regarded. And I'd been involved in a couple of consultations with him over the years. And he called me one day and he said he wanted to talk to me. And so we arranged for a time for me to go into his office. And we went into the conference room where he normally met with patients and families to talk about the things that doctors and patients talk about. And he sat down and I sat down. And he started to tell me about this patient. This was a woman that he had taken care of for years. And she had congestive heart failure, and by this point in her life, it was clear that she was dying. She'd been in and out of the hospital many times over the last year, and as her condition worsened, she had even told this physician that she knew she was dying, and when it got to that point that she could not continue to interact and engage with people, then she did not want additional intervention, that she had lived a good life and she was prepared to die. She'd actually talked with her children about this, and so the children who were from out of town were now in the hospital, sitting at the bedside with her, while she was on a ventilator, on many drugs, not really able to interact. And they said to this physician, you know, our mom would never want this. We really need to stop this and just shift to comfort care and allow her to die with dignity. The nurses, the young physicians, the residents in training, all of them were telling this physician, you know, it's time to stop. This woman clearly is not going to survive, and we know this isn't what she would want. It is time to allow her to die with dignity. So I'm sitting across from this physician. He's telling me this, and I'm thinking, well, okay, so this is all pretty clear. What's the ethical issue? Why are you calling me? After all, you're like the guy. You're the man. Everyone comes to you. And I'm thinking this to myself, but I'm being polite. I'm listening. And so he looks at me as he's talking, and he starts to look at me with one of those looks. The kind of look that actually we all know. It's the look that you give for a moment when you're walking down the street and you see somebody, maybe it's a homeless person, or maybe it's just the person who's walking the opposite way, and you give the look for a moment towards that person. And it's only normally just a moment, because if they look back, that's when that look changes. Because we actually don't want to continue holding that look Because if we do, we run a risk. We run a risk that not only will we see the other person who is standing before us or walking towards us, but that person will see us. And there's a risk in being seen, because in being seen you're revealed. So here it was, I'm sitting in this room and this physician is telling me this story and he's giving me that look. And so, because I am trained as a philosopher and to address intense, difficult things, I held the look. And as I held it, he then began to tell me what was really going on, which is that he knew that this woman was dying. He knew that the thing that needed to be done, the deed that needed to be done, was to stop all intervention so that she would die. Die with dignity, as she had asked him and he had promised that he would fulfill for her. And yet the problem was, he didn't know if he could actually do it. He didn't know if he could undergo the experience with this woman. Not because he hadn't done this with other patients, because he had. It was that with this woman he had a connection. And it wasn't anything special. It was simply that he had been her physician for many years, and he wasn't sure if he could. And he was telling me this because in that moment, what I became aware of is that who do you talk to? Who do you tell when you're the man, when you're the one that everyone goes to, that you don't know if you can actually do what needs to be done? And so we held that look for a moment, because it was the moment in which I became the opportunity for him to discover within himself what it was that was most valuable, so that he could move forward. And that's what I do. That's my job as an ethics consultant. Now what's interesting is it sounds pretty important, but you notice I've been holding this book, waving it around. It's a book that was written about 850, 860 years ago, written by a physician. It's actually a book on asthma. It's a very interesting book. It's a book of 13 chapters. The first 12 chapters are your standard sort of medical stuff about asthma. The 13th chapter is a summary of the first 12 chapters, as well as a little bit of sort of philosophical waxing by the physician about what it means to be a good physician. And there's something really interesting in this book that was written in the 12th century. I'd like to read it to you. There is a general rule, and I have seen great physicians acting on it, which is also keeping with the medicine of Hippocrates and Galen. And that is that the physician should not treat the disease, but the patient who is suffering from it. Now this is a very modern notion, so modern that 850 years ago or so, it was written in a book. It's making a reference to two physicians, Galen and Hippocrates. Galen, who was a Greek physician in the first century, Hippocrates, who was a physician about 2,500 years ago. And if you look at their writings, they say the same thing. Don't treat the disease, treat the person. And that means we have to pay attention to the person, who it is that's before us. So if we think about inspiration, all we really need to do is look to the right or the left of us. Who is it that is next to us? And do we dare hold the look? Look at them, recognize them, be with them. Thank you.